Yeah.
I cannot rotate my phone.
Always. Because under there,
allowed me to
everything's
do
in
that?
Spanish in here, but in the bedroom it's.
Hey, you guys. I'm having dinner with Niki. This was in DR.
Hello.
Funny thing, we were here together 2 years ago at this same time.
Mm-hmm.
So weird. And here we are in DR 2 years later. Same bat place, same bat channel.
But this time, surgery for me.
Surgery for Nick. Talk to them. Talk to the people about your surgery.
I'm here for muscle repair, revision, tummy tuck, 360 lipo, and BBL. So it's supposed to be on.
Your doctor?
Oh, my doctor's Bàez, Dr. Bàez. I went for my labs today. I got here last night, well, early this morning, and in my Airbnb. I didn't go to a recovery house. My husband is here with me, and I hired nurses, and I have a driver, a great driver, actually, Thomas. He's awesome. They need a driver. Thomas is the bomb. He told me I had an appointment with Manny today, so I was like, oh, okay. He already set up my appointments for me. He did everything, so I didn't have to do anything. So I'm very happy. And then I'm here with my girl.
I'm like, are we recording? I think we are.
Mm-hmm.
There we are.
And then my husband made some delicious food.
He did. Jerk chicken
Mm-hmm.
with rice and peas and cucumbers and plantains. Which I'm going to go to the second half now because it's so good.
The chicken is really good, babe.
It is very good. So Nikki's husband Ian is Jamaican, but you guys already know Ian. Oh wait, while Ian is here, I want to do the Q&A on Nikki's Toto because she's going to see Dr. Luciano again. I'm to tell you what she's going to see her for, but no, it was a question that Dr. Luciano had actually. She wanted to know, Ian, 2 years later, does the Toto still feel the same? He might just be pussy whipped.
Could be. Could be.
Which one did you say, Dario?
Huh?
Yes, the first one.
Yeah. So is he coming to Dr. You're coming to Dr. Luciano when she? Oh yeah. She's gonna ask you because she wants to know, like, on a man's point of view. And I was like, I never asked, but I told her that you guys had did a video for the website about
2 years ago.
the Toto situation. But anyway, so Nick is here. She's having surgery with Dr. Bàez. What are you doing to your Toto with Dr. Luciano?
The lip augmentation.
Which is technically the fat transfer.
The fat transfer. And then we're going to see Manuel.
She's having what I have, and she's doing the fat transfer. And then she's seeing Manuel. Oh, you know what? We can see Manuel on Tuesday. We're going to do the facial with Manuel on Tuesday. He just reminded me. He asked me about us coming on Tuesday, and I didn't respond. So I'll respond to him when I get off the live, and we'll tell him that. Are you guys seeing us sideways, or are you guys seeing us this way? I think we're okay this way.
You're like, they're just eating.
Yeah. So we're gonna go and see Manuel. I hate this phone because you don't always see the when you're sideways, you don't see people are talking to you. We're gonna see Manuel for fillers. Well, facials, and you're getting some fillers.
Nasal filler. And then a facial to get the dark marks off my face. So I'm excited about that. Nasal, so see it now, these lines right here.
The nasal fold.
Nasal fold fillers. And then get the dark marks.
Tell them what happened when you sent Manuel your pictures.
Oh, I sent him the pictures. He said, you need this. He said, I need 5 things. I said, no, I'm going to get 2. But he was like, oh, no, you need it all. You're going to get 3D nose. You're going to get nasal. You're going to get Botox and the face. I was like,
So you don't want to do your nose?
oh, I like my nose.
Okay. Niki likes her nose. This is my 3D nose. This is how my
Your
nose
is
came
nice,
out.
though. Looks good.
From Manuel. Oh, and this is my Kybella.
Mm-hmm. It looks good. Especially in person, you can really tell.
Oh, this is my Kybella. Yeah, this is my Kybella. The chin fat.
And it looks good in person too.
So Niki likes the way my Kybella looks.
Mm-hmm. And she still looks the same. She looks good after 2 years.
All right, my body.
Mm-hmm.
I think my ass got bigger.
Yes, big.
My ass is huge.
We crossed the street and they stopped.
Niki almost got hit today by the car.
Mm-hmm.
She almost killed herself.
Because my booty not big yet.
So my waistline is still good. And I think like my ass is just gargantuous. Ian, is my ass too big?
It's like, what?
Is my ass too big? This is my first time wearing pants since I had my toto done. When I first put these pants on today, I had like what was it called? What I call
Camel toe?
I had camel toe, and I still think I might have the imprint of camel toe, but it is what it is. And I was like, oh no, we ain't doing no camel toe. We don't do camel toe. So I'm getting my teeth done this week. My permanent teeth will be in this week. Mika's having her surgery. And then I'm going to stalk the office of Ricardo Ventura or Fernando Guerco to get my consultation for my surgery in July or August.
And what are you getting done again?
So I want to do arm lipo, vaser lipo, arm lipo, thigh lipo, and ab etching. I'm going to do my back. And that's what I'm trying to do with him. I might even, if I have time, I might even have him take the extra skin off of my hooded eyes. Unless Monroe can suck me all the way up. And we'll see. So that's it. There's where we are. Ian made some delicious cucumber salad.
And delicious jerk.
I have my temporary teeth in, so I cannot bite into this cucumber. So I'm going to break it in pieces. And hopefully I'll be able to eat some cucumbers because I love cucumbers. But my temporary teeth, oh no, I can't bite into none.
I know. Just a couple more days though.
Mm-hmm. Just a couple more days. It feels like I have dentures in my mouth. So Wednesday, my teeth is in and then I'll be ready. So that's that. So I guess Nick will continue to tell you about her journey. She's seen Dr. Bàez, and tell him again what you're having before we go.
Muscle repair, revision tummy tuck, 360 lipo, BBL.
Oh, hold on. Let me see if I can read some of what people are saying.
Only to just see who's watching.
Oh my God, Kiki! Hi, Kiki! How is life in Louisiana? Oh my God! Hi, Maury. Are you still in Korea? Because I am going to stop. I know you're Korean. Are you still in Korea? Because I'm going to the Philippines and I'm going to stop in Korea, in Seoul. For at least a day. Because the Philippines is like in a whole nother, that's on a whole nother planet. Hi, Miss Elder Moore. How are you? Are you guys seeing me straight? Or are you guys seeing me sideways? So, what's up with you, Miss Kiki Bates? How's life in Nolans? Yeah, and that's it. So we're here again. This time, hold on, let me pan the camera out. Hold on. There we go.
There we go.
There we go. This time it's Niki's turn.
Yes.
Look at how fine on. Look at Ian.
Poor baby.
Poor baby.
Sleep.
She's seeing Dr. Bàez.
I'm excited and nervous and excited. I've been waiting 2 years to do it, and this is my opportunity to do it, so I'm going to do it.
But those 2 years went by quick. It's hard to believe that it's been 2 years. It felt like we were just here. Which is weird that we're here together 2 years later. Again. So I got the fat transferred in my toto. So Nick Nick wants that done as well. The fat transferred in the toto. So I'm excited for her to have that. And that's it. So here we are back in the DR. Hey. My toto is coming along. It's been officially 1 week. I literally have like no pain. I haven't taken any of my painkillers today or my antibiotics because I forgot. And I probably won't. Santo Domingo closes like at 7 o'clock. Are we on curfew? We're probably on curfew right now. So I'm stuck at Niki's place until tomorrow. But this baller lady right here, her Airbnb is big enough to accommodate me. She's across from the ocean. And that's it. That's all that's happening. So we're going to go.
Good to see everyone again. Last time I saw you, I was in Colombia.
Show them your teeth. And let them know about how your teeth is working out.
And wipe my mouth. My teeth are still good. They're working out great. And my bite is normal again. It felt off for like maybe 9 days, but before 2 weeks it was better. And so I have my bite back. And so it's great, no problems. I use my molars just in case, they always say cut any hard, tougher meat.
Chew in the back.
Don't chew in the back. I like the way, I forget that because we're a mask all the time, I forget that I have my teeth done. Then when people see me, they're like, oh, your teeth. I was like, oh yeah, I got my teeth done, thanks.
Cute. They look nice. I love them. I can't wait to get mine on Wednesday. Because I feel like when they take off these temporary veneers, because it's like a cap, it's like a pageant cap, I don't know what's going to fall out of my mouth. Because I think like everything that I eat gets stuck in there somewhere. It's really weird. So, Nick, tell them about you having your labs today.
Oh yeah, today's Sunday. I have my labs this morning. And so I'm going to see Manny and Dr. Bàez tomorrow at 9 o'clock. And so I'll get my lab results. Hope my hemo is well. It was a little lower than what I expected when I got them done at home. I got my results, so hopefully it's been up. My husband made me beet juice. I had liver for Thanksgiving. I've eaten liver, drinking beet juice, fresh beet juice that he made for me, and he made me liver, and that's what I've been doing. And doing the liquid iron and then my regular vitamins. So pray that my hemo is good. I'll find out tomorrow, and I'm excited. Nervous and excited. Then my cousin, she's actually coming too. She's coming next week to come see me. And she's going to see, she wants to like the Kybella, and then she's going to see Dr. Pina also. So it's a family affair. I got a 3-bedroom because I got, since my nurses, I'm going to have my nurse here for 10 days. It's going to be like 3 days for 24 hours. And then the other days it's going to be like 10 hours and then down to 8 hours. But I'll have my nurse here for a total of 10 days.
Okay, baller, I'm here, girl.
And so I wanted privacy, so I'll let you know how it is at a recovery, at a Airbnb versus a recovery house. So we'll see how that is.
Well, have you been in a recovery house?
No, not versus, well, no. I'm going to say how it was here.
Yeah.
I just know what other people say. You stayed in a recovery house in the beginning.
Yeah. Biggest mistake ever.
And plus, my husband, he came because he works remote, so he can work from anywhere. So it was a good time for me to come and for him to come with me. And Thomas is an awesome driver. I have to put his name out there. He's awesome. So if you're looking for a driver, I will put his number in the comments.
Okay.
All right.
So that's it, you guys. I hope you guys can hear us. That's it. We're gonna go, and I'm gonna finish eating my rice and peas because it's so good. I had to get me an extra helping of rice and peas and some plantains.
And my poor husband, he fell asleep.
Ian fell asleep on the couch. And so that's it, y'all. We're out until tomorrow.
Tomorrow or
Yeah.
Wednesday. We'll see what happens.
We'll try to do a video from Dr. Bàez's office depending on how busy it is. Were you the only one over there taking your labs today?
It was just somebody, just a random person, like probably not for surgery, but just for something else.
American?
It was American. It was an older lady.
Okay.
With her husband.
Yeah, I don't see a lot of American tourists here having surgery. Maybe because I've been on like the dental side, and I haven't been to any of the like surgery facilities. But even coming in on the airport, because normally I see a lot when you come in. I think it's
I came in late, so. But I know it was one young lady who's coming in with Bàez, because I saw her in the Bàez group, so.
Oh, you saw her on the plane?
She mentioned she was going.
She mentioned
she's getting her surgery tomorrow.
Oh, okay. Oh, she's already here. Yeah. Okay. Well, other than that, I don't see a lot of people coming in and out. Like I said, Santo Domingo is closed down because of Corona. They have a 9 o'clock curfew during the weekday, and on the weekends it's a 7 o'clock curfew. So since I'm at Niki's place, it's going to be difficult for me to get a cab back. Can I just do that? So I'm just going to spend the night. Sorry, y'all. So I'm just going to spend the night. I'm going to go with her to Dr. Bàez's office tomorrow, and then go home from there. So that's it, y'all. Oh, that's Dr. Barbara from Dr. I'm reading my text message. That's Dr. Barbara from Dr. Luciano's office. We will do videos from Manuel Valero's office because we're going to go for the body treatments to remove blemishes off your skin. And I don't know if it's me. Like, Niki, does my skin look clearer now that I'm here in Santo Domingo? Does my skin look clearer now that I'm here? I'm thinking like my skin should be darker because I'm in the Caribbeans. But I think like my skin is looking lighter. Isn't my skin looking lighter?
Let me see. Let me look at you.
Isn't that weird?
Oh, it does look lighter.
I think I should be looking darker because I'm here in the Caribbeans. But no. I'm becoming a Becky. So anyway, you guys. So that's it for now. And we're going to go back to eating our dinner. And we'll talk to you. Oh, what's the difference between the G-shot and the G-stimulation? Okay. What's the difference between the G-shot and the G-stimulation?
I don't know.
It's probably one and the same, just by a different name. I got the G-shot stimulation. And what she did was, she put me in one of those specula like they do when they give you like a like a pap smear. And she lasered like my G-spot, which is up there. So she lasered my G-spot, which is up top if I'm laying down. And she lasered it so it can have more sensitivity. And then she lasered my clitoris so I can have more sensitivity. Was that the G-shot? That was the G-shot stimulator. Manuel does something with the G-shot, but he uses your own blood like a PRP.
He does a plasma, right? And then injects
Yes, and he injects it. When we get to Manuel on Tuesday, I will let you know like what it is. And have him explain that process. Dr. Luciano also lasered my clitoris so I can have more sensitivity, and I can feel it even when I'm sitting down. If I really want to, I could be like, ooh. So I can feel that very easy. And then she lasered like the outside of my toto. I'm gonna stand up, Ian's sleeping. So she lasered like through here, like, oh, let me back up. Yeah, like in there, like she lasered, and that felt like prickies hitting me. And so I haven't tried it out, so I'll have to let you guys know how it goes, what it feels like. Like I said, I practically invested $5,000 in my toto, so which means I need a $10,000 investment before any man gets it. That's all I'm saying. So I may be holding on to this for a while. But I am going to do a Q&A with Dr. Luciana Pina before I leave. I'm going to see if she has time tomorrow or whenever we go see her. This week when we go see her. Mm-hmm. And I will see, I think maybe you should see her and get your toto done before your surgery. Because we need fat.
Oh, that's true. I don't want to lose blood. Good mahima.
I didn't have any bleeding. You don't have any bleeding.
Oh, okay.
The bleeding was minimum. Even
well,
like...
let's talk to her tomorrow and see what she thinks.
Even talk to who?
Dr. Luciana.
Okay.
Mm-hmm.
Yeah, because even now, like I still don't have any bleeding. I was cut. So they cut my lips and they cut it down. Like, you know what I mean? Like, here's the clitoris. And then so they cut the lips down like into like a V. Because you look like a V down there, actually. Mm-hmm. The badge is a V. And then what she did at the end of that V, like where my vagina, and then you have a little space, then of course your anal hole. She made, at the end here, she made this tighter. So... like mine goes down in a V, and then she tightened up like my V there. And so you should ask her about that because you're gonna need some fat. The fat that she removed from me was my fupa fat. The way that you don't get the fupa fat is you need to wear the boards.
Lower.
Yeah, or you need to take like Kotex. Like pad. Do you have pads?
Mm-hmm. I brought pads. Poise pads.
Poise pads? Mm-hmm. Which is so funny because I was wearing my Depends for a little while. Oh my God, you guys, I'm finally out of the Depends. Because I have on no clothes and no Depends on. But I waited like a whole week. So now, like when I go home, when I'm at my own place, like I lay like on my bed, commando, and I give my toto air because I have been cut. So you need air to scab up. Mm-hmm. So I give my toto air and I sleep literally with my legs wide open so I can have some air. And I've noticed the difference because I think I could have scabbed up faster if I wasn't wearing the Depends. But I literally wore the Depends for like pretty much like almost a week. I wore the Depends. And then I decided to not wear the Depends anymore because I wanted to give my toto air. And I was coming to the end of using, actually at the time when I was wearing the Depends, I had to put that antibacterial suppository. When you come and you see Dr. Luciana Pina, she loves to give you creams. Mm-hmm. She will give you, hold on so you guys can see Niki. She will give you,
I'm like, what?
She will give you all kinds of toto creams. So
I still have creams. I'm like, I don't need all these creams 2 years later.
So she had given me some like creams that I had to put in, and I used those creams to because I think they are antibacterial creams. So that I wanted to use because you use the antibacterial.
You have to.
So it looks, you put it in a thing like the monostat that you stick in you, and then you fill up the tube and then you just insert it in you. I did use the 6-day cream because it was a nice tube. I still have the cream, but what I do with the cream is I just put it on my outer toto because it's like some kind of antibiotic cream, and I did get the laser on the outside of the toto. And I have this steroid cream that I use because you know how you get like little eczema patches. I'm using that steroid cream on my toto, y'all.
Wait, what does it do?
I think it helps me scab up faster and healing faster. Like I've noticed a difference in my healing. So.
What can you see if they ask any questions so far away? Can you see?
Oh yeah, let me see if there's any question. Thanks for this info. Oh, you're welcome, Boo. Boohan, you're welcome. Yeah. So yeah, that's it. that's it for right now. So when we get to Dr. Luciana's Pina, I will ask her the difference between the G-shot and the G-stimulator, and any other questions that you guys want to know. So you guys can ask her. I'm gonna have her talk about the full range of services that she offers. I did get my pap smear from her. Sorry, you guys, I have to adjust. I still have stitches, and every now and then, ooh, it irritates me. Like one of the stickers is like sticking something down there. I want her to talk about the full range of services that she offers. Like I did get my pap smear from her. And the reason why I got my pap smear in Santo Domingo and not America, it's because I have an appointment with my doctor on the 28th of December for a pap smear. But with my new toto, I don't want my doctor touching me. Leave me alone. So I won't see her till next year. But my pap smear came back okay. I will get all of my results from her like before I leave. I had a chest x-ray, a chest x-ray, which I'm really interested in because 2 years ago, I had to get a biopsy on my chest because they found nodules in my lungs, but it turns out that they were just air bubbles, air pockets, and they told me it would go away, and they went away. So I have a little scarring on my lungs from that situation, but it's no longer there. I haven't, after my biopsy in America 2 years ago, I never got another chest x-ray because the opportunity just never came up and I haven't needed it. I got the, before I had my surgery with Dr. Luciano, I had a full panel, like full blood panel, x-ray, echocardiogram, ECG, the whole shebang, which cost me about $310 in addition to the $4,800 that I got for the Toto. Talking about Toto, she does have a Black Friday sale, you said?
Yeah, she has Black Friday.
Do you remember the prices?
I can get it for you.
Yeah, she has a Black Friday special right now. Clearly I did not get the Black Friday specials. But Niki wants me to use my influence. I'm like, why am I itching? Money in my titties, okay? Niki wants me to use my influence and get her discount. And I most certainly will because I think I paid enough for the both of us.
Because I don't have $5,000 for a Toto.
But my Toto is the works.
Yeah, she got the designer.
I got the design. I got the official designer Vagina.
So her specials are Black Friday O-Shot for $250. She has the vaginal tightening and O-Shot for $690. Let me go back. And then we have the vaginal tightening for $520. The G-Shot for $350. We have the vaginoplasty for $2,390, and we have the labiaplasty for $1,500. We have the G-shot stimulation for $350. We have the O-shot and the G-shot for $490. And we have the vaginal tightening, the O-shot, and the G-shot for $850. So those are her Black Friday specials. I'm not sure how long she's going to honor them, but we'll ask her that also.
Yeah.
How long that will ask. Because I asked her about the Black Friday specials because I'm a Black Friday shopper.
And clearly I got mine before Black Friday, so I did not take advantage of Black Friday. But we added up, and I pretty much got a good deal.
Mm-hmm.
I probably paid a little less because I got everything she mentioned. Everything.
Yeah.
I got the works. So everything she mentioned on that list, the G-shot, O-shot, everything, I got. Oh, and the clitoris stimulation. I wonder if the clitoris stimulation is the
And she doesn't have that on here for a special.
The O-shot.
Oh, the O-shot, yes.
I think the O-shot may be the same as like the G-spot, is the same as the clitoris stimulation. Because you're not going to put clitoris stimulation. Because if you stimulate your clit, you're going to have an orgasm.
Mm-hmm.
So that might be the We're going to ask her. We'll ask, these are things that we'll ask her like when we see her. But I got the G-shot, the G-shot stimulator, the O-shot. She even stimulated outside of my toto. And then I got the labiaplasty where she cut the labia majora and did the tightening at the end. Like my hole is like extra small. And then I got the fat transfer. Yeah, those are great prices.
Mm-hmm.
And then I got the fat transfer on the labia majora, the outer pussy lips, so that it can be fat, and it doesn't look bad at all. So I haven't showed Niki my toto yet.
I think the doctor's gonna show it tomorrow.
She must.
Because y'all
She'll be like, here's Cindy's pussy right here. But when she saw my toto, she was very excited about her work that she had done. And actually, aesthetically, the pussy looks good. And then she was like massaging it. So I've gotten to the point now where I massage it because like I can feel like just a row of fat there. So I just massage it so it can, you know what I mean? Like when you get lipo, you need to massage. So now I just, that makes sense, right?
Mm-hmm.
So that's a job for Ian.
Mm-hmm.
But like, yo, can you massage my pussy lips, please? Thank you.
It's like, okay, he's asleep. He's asleep, y'all. He can't hear.
He's knocked out. But knowing Ian, he'll be like, okay.
Whatever you need, baby.
Yeah. So I massage it because, so you can distribute the fat evenly.
Mm-hmm.
Yeah, the same as you do with your body. I don't see why you shouldn't. I don't have my hole for okay. So she took the fat from like here, my fupa fat, the one that I hated. And I know because I can bend over and I don't really have it. Because before I can like, ching, 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 bang, bang, bang. And now I can't do that anymore. But it is kind of tender. So she took the fat from right here, but she went in through right here where Yili had the first lipo hole, and she just got me from here and went through the same hole. This hole on this side looks good. This one was a horrible hole, so I'm gonna have Manuel Valero bleach it out. But like here, if I touch through here, it still feels a little tender. I don't have a lot of, it wasn't like a full lipo, so it's not like I had to like drain, but I just normally just give myself a lymphatic massage. So I'll massage through here just to make sure like I'm even, because I'm tender. So I'll massage it myself, and then I'll just massage to make sure that my fat is distributed evenly on like my toto, because I don't want to have one big lip, one small one. So I'll be like massaging, because then that would be a deformed toto, and nobody wants a deformed toto. Yeah, so that's it. So that's it, you guys. We are out of here, and we will be talking to you tomorrow from Dr. Bàez's office. So hopefully Dr. Bàez will have time to do a little small Q&A.
That'd be good.
She's still in the same office from 2 years ago?
I saw today. I think it's the same office. I couldn't remember. It looked familiar.
Okay. Yeah.
Because we parked in front of her office, but then we had to walk next door to go to the lab.
Oh yeah, the lab is on the side. Yeah. Okay. So yeah. So anyway, so that's that. Also, I mean, I know she's still in the same hospital. She's still on the same floor in the same place.
He said the 5th floor. That's what Thomas said today, my driver.
I think she was on the 5th floor
Oh,
before.
okay.
Yeah, she was already there. Okay, you guys. So that's it. So we're out of here.
All right.
And then we continue this tomorrow. So yay, Nikki's getting her sexy on. It's Nikki's turn. 2 years in the making. Hey. And then and then we will definitely do some videos tomorrow, and we're gonna do some videos with Manuel Valero for our
Face. In my
on
facial.
to get the facial on Tuesday. I'm gonna thing him right now, actually, once I get off this. So that's it, you guys. Have a great evening, and thank you for tuning in. So
right.
look, here's another Snatch Life doll getting her stuff together.
Getting ready.
Yes. So everybody, please keep Niki in your prayers. So keep Niki in your prayers, and we'll talk about her surgery closer. We'll do another video the night before your surgery, so we can talk about it and see how you feel.
Yeah, because I'm gonna need a peel or something. No, just kidding.
Oh, your teeth look real good. Look at her teeth. Her teeth look so nice.
Always show the bottom part, because you can't see the bottom. I don't think. I like it though.
They look good. They look good.
They feel good.
And then I'm getting mine on Wednesday. So I am excited. Didn't I come here? My baby hair was laid. What happened to my baby hair? It's no longer laid.
It was outside, in the sunroom.
I came with laid baby hair, but now my baby hair is like, look, I gotta go curl up. Okay, you guys. So we're gonna go, and then we'll talk to you guys tomorrow. Have a great evening.
Good night.
Good night.